Most people preparing for knee replacement spend their time talking to their doctors, researching surgeons, and mentally bracing for the recovery. All of that matters, but there's something else that can change how quickly you can recover, and most patients skip it entirely. I'm talking about physical preparation. The exercises you do before surgery can shorten your hospital stay, improve your knee's early range of motion, and give you a head start in those critical first few weeks. And here's a bonus that many people don't realize. The exercises you do before surgery are often very similar to the exercises you'll do after surgery. Learning them now means that you'll already be skilled with the movements when they matter most. Hi, I'm Dr. George Bounajem, Dr. B for short, and I'm a Harvard-trained, board-certified orthopedic surgeon who specializes in hip and knee replacements. In this video, I'm going to walk you through 8 effective pre-op exercises organized into 2 groups. We'll start with foundational strength, then move on to functional readiness. Like with any exercise program, get clearance with your medical team first before trying these yourself. Let's get started. The first exercise is standing hip abduction. That's right, a hip exercise. I'll explain why in just a moment. This exercise strengthens your gluteus medius and gluteus minimus, the muscles on the side of your hip that are critical for side-to-side stability. Every time you take a step, these muscles keep your pelvis level. Weakness here often shows up as a limp or a side-to-side wobble when walking. Building this strength now means a more stable, confident gait from day one. To perform the standing hip abduction, stand holding onto a counter or the back of a sturdy chair for balance. Keep your surgical leg straight, with toes pointing forward. Slowly lift that leg out to the side to about 30 degrees. Keep your toes pointing forward and your torso upright. Pause briefly at the top, then slowly bring the leg back to the starting position. As you get stronger, you can use a resistance band to make the exercise more challenging. One of the most common mistakes is leaning your torso to the opposite side during the movement. This makes it easier, but it defeats the purpose. Only your leg should move, while your body stays still and upright. Also, avoid turning your toes outward. Your toes should stay pointing forward throughout the movement. Lastly, don't swing the leg. Move with control, making sure the motion comes from the strength of your hip, not momentum. Aim for about 2 sets of 10 to 15 reps, about 3 times a week. These muscles can get sore, so you may not need to do them daily at first, but you can increase the frequency as tolerated. Now let me explain why we started with the hips when you're having knee surgery. Here's the reality. The leg works like a chain. Your knee doesn't function in isolation. It depends on the stability of the hips and core above it and the foot and ankle below it. When any link in that chain is weak, your knee has to compensate as a result, putting more strain on your new joint. Your hips provide lateral stability. The gluteal muscles we just worked keeps your pelvis level when you walk, prevents that side-to-side limp, and reduces the stress on your knee. Your core also provides stability during movement. Exercises that train your abdominal muscles, spinal erectors, and obliques give you a solid foundation for every step and transfer. And your calves provide push-off power for walking. They propel you forward with every step, and weak calves mean shuffling feet and slower progress. This is why we're not just doing knee exercises. We're preparing your entire lower body to support your recovery. And now that you understand the chain, let's keep building it. The second exercise is the bridge. Bridges strengthen your gluteus maximus, along with your hamstrings and core. These muscles power virtually every functional activity, including standing up, walking, and climbing stairs. Strong glutes help improve your walking pattern after surgery and help reduce unnecessary strain on the knees. To perform bridges, lie on your back with your knees bent about 90 degrees. Your feet should be flat on the floor, about hip width apart. Squeeze your glutes and lift your hips off the bed until your body forms a straight line from your shoulders to your knees. Hold for 2 to 3 seconds at the top, then slowly lower back down. One of the most common mistakes is hyperextending your lower back. Focus on using your glutes and hamstrings, not your back, and avoid using momentum to swing up. Also watch for knees that splay apart or collapse inward. Keep them aligned with your hips. Lastly, pay attention to foot placement. If your feet are too far or too close to your body, you might feel it more in your quads than in your glutes. Adjust until you feel the work in your buttocks and your hamstrings. Work your way up to 10 reps if you can, and you can add a second set as you get stronger. Doing bridges 3 times a week is often plenty, especially if you haven't worked on your hips or core in a while. The third exercise is actually a progression, quad sets leading into straight leg raises. The quadriceps are the large muscles in front of your thigh, and research consistently shows that healthy knee function is closely linked to quadriceps strength. That's exactly what you're building with these exercises. They fight against something called quad inhibition, which is where your muscle refuses to work because of the knee pain and swelling. Getting a strong quad contraction before surgery means that you'll be able to activate that muscle more easily after surgery. And here's a bonus. These are some of the first exercises you'll do after surgery. Learning to do them now means that you'll be an expert when it really matters. To perform quad sets, lie flat on your back with your legs extended. You can place a small rolled towel under your knee for feedback. Tighten your thigh muscle as if pushing the back of your knee down toward the floor. You should feel your knee straighten. Hold the contraction for about 5 seconds, then relax. For quad sets, don't just think you're tightening the muscle. You should actually see and feel the knee straighten. Avoid holding your breath, and breathe out during the squeeze. You can do quad sets daily, even multiple times throughout the day, because they're not very taxing. For each session, aim for 2 to 3 sets of 10 to 15 reps. Once quad sets feel easy and you can fully lock out your knee, progress to straight leg raises. To do a straight leg raise, tighten your quad with a quad set. Then lift your foot about 12 inches, keeping the knee completely straight. Hold that position for a second, then slowly lower the leg back down. For straight leg raises, the biggest mistake is lifting with a bent knee. If your knee bends during the lift, you're not ready for the exercise yet. Go back to quad sets until your quads are stronger. Keep your lower back flat on the surface to avoid straining it. And if needed, you can bend your opposite knee to keep your back comfortable. For straight leg raises, 2 to 3 sets of 10 reps, done 3 times a week, is a reasonable goal. The fourth exercise is long arc quads, and it helps bring the foundational quad strength you built to another level. Long arc quads strengthen the quadriceps muscle through a full range of motion in a seated position. While quad sets and straight leg raises work your quads without much knee motion, this exercise strengthens them through a large motion. To perform long arc quads, sit in a chair with your knees bent about 90 degrees. Feet flat on the floor. Slowly straighten your surgical knee out in front of you until the leg is as straight as possible. Hold for 2 seconds at the top by squeezing your quads, then slowly lower until your foot rests on the floor again. As you get stronger, you can make the exercise more challenging by adding ankle weights or a resistance band looped around your ankle and the leg of your chair. Don't kick your leg up quickly or let it drop down. As always, control matters. If this exercise is uncomfortable because of the pain at the front of your knee, you can do short arc quads as an alternative. Lie on your back with a towel or foam roller under your knee, and slowly straighten the knee. Hold the contraction for 2 seconds, then slowly lower your foot. Aim for 2 to 3 sets of 10 to 15 reps, and do the exercise about 3 times a week. The last foundational strength exercise is calf raises. This exercise strengthens the gastrocnemius and soleus muscles, which power your foot's ability to push off the floor. Strong calves mean smoother walking. They also contribute to your ankle stability and overall balance. Many patients have weak calves because of the years of inactivity due to the knee pain. So building the strength now means that you'll have more propulsion when you need it. To perform calf raises, stand at a counter or behind a sturdy chair with both hands lightly on the surface for support. Place your feet hip-width apart, with weight evenly across your forefoot. Bend your knees slightly to avoid lockout. Then rise up onto the balls of your feet by going straight up. Pause at the top for 1 second, then lower down slowly, taking 2 to 3 seconds. Keep your torso upright throughout the movement. Don't bounce at the top or bottom. The motion should be slow and controlled. Avoid rolling your ankles or feet outward or inward, and think of going straight up, not forward. Stay upright by keeping your shoulders over your hips. Avoid locking your knees, and instead keep a slight bend to reduce knee irritation. If standing calf raises are too challenging at first, you can do them seated. Sit with feet flat and knees at 90 degrees. Lift your heels up as high as you can, and hold them for 1 second. Then, slowly lower your heels over the next 2 to 3 seconds. Aim for about 2 to 3 sets of 8 to 15 reps, and do calf raises about 3 times a week. Now let's move on to functional readiness. You've built the foundational strength you need. Now you translate that into actual mobility. These last 3 exercises focus on restoring your function by enhancing your flexibility, your balance, and your coordination. The 6th exercise is heel slides. Heel slides work on knee flexion, which is your ability to bend your knee. This is essential for sitting in a chair, putting socks and shoes on, climbing stairs, and countless other activities. Doing heel slides before surgery helps you maintain or improve your current motion, and prepares your knee for the bending work you'll do after surgery. To perform heel slides, lie on your back. Slowly bend your knee by sliding your heel toward your buttocks, keeping your heel in contact with the surface you're on. Keep your kneecap pointed toward the ceiling. Wearing a sock can help reduce your foot's friction. You can also use a towel or strap to push your knee's motion further. Go until you feel a stretch in the knee. Hold the bent position for about 5 seconds at your maximum bend, Then straighten your leg back out, sliding the heel forward until the knee is flat again. Avoid fast or jerky motions. This should be a slow, gentle stretch. Don't let your hip and leg rotate outward. Your kneecap should stay pointed toward the ceiling throughout the movement. Some mild discomfort at end range of motion is normal, but avoid anything too severe. Try to gradually push a little further each day without causing excessive pain. 2 sets of 10 slides is a good session for many people, and since heel slides are more of a gentle stretch than a strenuous exercise, they can often be done daily. The 7th exercise is single leg balance. Walking is a complex movement that we often take for granted, but you can think of it as a series of single leg stances. Every step you take, you briefly balance on one leg. Improving your ability to stand on one leg improves your gait safety and efficiency. Many patients have avoided using their leg for years due to the severe pain, and balance can seriously suffer as a result. This exercise rebuilds that skill, and just as importantly, improves confidence in your leg before surgery. To perform the single leg balance, stand near a stable support like a countertop or the back of a sturdy chair. Shift your weight onto your surgical leg and lift the other foot off the ground, bending that knee so the foot is behind you. Try to stand on the surgical leg for as long as safely possible. Start with a goal of 10 seconds. Use your fingertips on the support as needed to prevent losing your balance, but challenge yourself to hover your hands without touching it if you feel steady. Engage your core, look straight ahead, and keep a slight bend in your standing knee. Try to prevent the hip you're standing on from dropping or sticking out to the side. That's a sign of your gluteus medius and minimus muscles not working effectively. Actively use those muscles to keep your pelvis level. Avoid holding your breath, and don't lock your knees straight. Keep a small knee bend, and use your thigh muscles for stability. Aim to accumulate about 1 to 2 minutes of single leg stance time on each leg per day. Start with 5 to 10 second attempts with brief touchdowns in between. Gradually increase the duration of each attempt to 20 to 30 seconds if you can. You can do this daily, preferably when you're fresh because balance can be hard when your legs are tired. And now we arrive at the exercise that ties everything together. The 8th and final exercise is the chair squat. This is the movement that you'll do thousands of times in your recovery. Every time you get out of bed, rise from a chair, or get off the toilet, you're doing part of a chair squat. It's also a fantastic functional exercise because it works your quads, glutes, and hamstrings all at once, while training the coordination between your hips and your knees. To perform a chair squat, sit in a sturdy chair with your feet flat on the floor, about hip width apart. Scoot forward so you're at the front edge of the seat. Lean your torso slightly forward. Push through your heels and stand up, using your thighs and glutes. Stand upright for a moment, then slowly lower yourself back down with control. As you get stronger, you can slow down the lowering phase to about 3 seconds to make each rep more difficult. You can also reduce the time you're sitting between reps, or even just lightly touch the seat, then start the next rep by standing back up. Avoid using momentum or throwing yourself forward, and don't drop yourself into the chair on the way down. Move with intention and control. Don't let the knees cave inward. Keep them tracking over your toes, and resist the urge to rely heavily on your arms. Use armrests for balance if needed, but let your legs do the majority of the work. Aim for 3 sets of 8 reps, and as you get stronger, you can add more reps. 3 sessions a week is a good place to start. Once you can do more than about 15 reps per set, you can make the exercise more difficult with the strategies we covered. Now that you know all 8 exercises, let's talk about how to structure your pre-op program. The sweet spot for doing exercises before knee replacement is usually in the 4 to 6 weeks before surgery. This gives your body enough time to adapt and get stronger. But even if you only have about 2 to 3 weeks, that's probably better than not doing anything at all. Aim for about 3 sessions per week for most of these exercises, ideally with at least 1 day of rest between them, especially if your muscles get sore. Lower intensity exercises like quad sets, heel slides, and single leg balance can often be done daily. And just know that these exercises should feel a little bit challenging. If a set feels too easy, you can increase the reps or add light resistance. If it's too hard, reduce reps or modify the exercise to make it easier. The goal is progressive challenge, not exhaustion and pain. The work you do in the weeks before surgery is an investment in your recovery. And remember, many of these exercises are very similar or even identical to the exercises you'll do after surgery. You're not just getting stronger, you're also learning movements that will become part of your daily routine during recovery. If you'd like to prepare even better before surgery, here's my video on how to prepare your home before knee replacement. I cover how you can make your life easier during the recovery, and how to reduce your risk of falling after surgery. And if you also want to know my top 8 exercises for the first 6 weeks after surgery, I'll put my video on that right here. If you found this helpful, click the like button and consider subscribing for more knee replacement education. Stay well, and I'll see you in the next video.